Yes, so there are several companies that exist that try to fill that gap. I know that there are lots of course creators that are designing new grad boot camps because there's a definite difference between being a graduate and then being thrust into the professional environment. And so those extra skills that we may not necessarily have time in the curriculum to address, we're able to do so through continuing education, additional workshops, companies that are now seeing the value in helping these students make that transition. And I think that we're going to see more moving into the future.
I was very lucky in my first job in 1988 working in a perio practice, and the other hygienist had 20 years experience, and she really helped me, and I learned so much from her because learning does not stop with that diploma in your hand or that Bachelor of Science in your hand. Learning happens every day, and we need to be open to that.
I think there's a little room for improvement, obviously, but I do think that they give a great foundation to the dental hygienist. But again, that goes back to the dental hygienist really making sure that as a new graduate and new to the profession that you understand that dental hygiene school is your starting point and you need to really commit to being a lifelong learner.
So I really do think it depends on where you are and what school you go to. At a minimum, I think all programs will certainly prepare students with entry-level education. There are some areas where I feel like there can be improvement, and as a former educator, I understand that there's only so much that we can teach in a curriculum. So in terms of how to bill and code and maybe some more interpersonal skills, but for the most part, I think we do a good job of preparing our students.
There's a whole line of instruments out there, and I believe there needs to be just maybe more hands-on courses, more lunch and learns, learn to work with them. So if you get to try that instrument and have feedback from the professional and have somebody teaching the hands-on course that knows the instruments, then it's a continual learning process, and we need to continually update our skill level.
I think tailoring your treatment to the patient is becoming more mainstream in the UK rather than a one-size-fits-all approach. I really believe that that will be key in our future as a profession, and also kind of tailoring appointment lengths, different modes of treatment. I think will be key in the future for us as a profession.